Good evening, everyone. Literally just waiting for 4 minutes, then we're just about to start on this webinar for the urinary tract infection. Very much looking forward to this evening. So thank you for all of you who have joined. Thank you for being here. We have literally 4 minutes to go, and we are going to be essentially looking at urinary tract infections from start to finish. So thank you very much for being here. I hope you're all keeping safe. We have, as I mentioned, about 4 minutes to go. If you've got any questions, write it on the chat. Please do write it on there. Get yourself comfortable, get a cup of tea, relax, really enjoy this. We're going to be spending around 50 minutes, 40 to 50 minutes together, and we're going to be going through this in depth. In actual fact, it's a particular condition or a topic that I was very much asked for a lot of patients in my pharmacy, in our Bicester branch and Oxford branch, where we kind of did a bit of a survey about a week or so ago, and we had patients anecdotally or mentioned, yes, urinary tract would be good. So we're doing urinary tract infections today. Next week, it all depends on what you guys would like me to do. We can do pretty much anything that needs to be done. So we'll be doing a poll out there to go through that as well. And we intend to be starting in the next 3 minutes. So for those of you who are joining me, thank you very much for being here. Get comfortable. And as I mentioned to you, in the next 2 minutes, we're going to get pretty much right into this. We're going to be looking at everything from start to finish from a urinary tract infection. So you folks can safely, essentially, be in a position to know exactly if you've got a urinary tract, what needs to be done. Should it be seen by a pharmacist? Should it be seen by a doctor? And so we're managing this appropriately. As we know, with COVID and the way things are at the moment, it's the NHS is under a lot of pressure at the moment. And what we are trying to do is to ensure that patients are getting the best healthcare and the right healthcare. So if it needs to be seen by a doctor, you go to a doctor. If it needs to be seen by a pharmacist or can be dealt with in the community, you go to a pharmacist. So essentially, that's what we're trying to do. And that's one of the reasons why I've set these webinars up. So again, as I mentioned, we've got 2 minutes to go. We're going to be starting on exact time. The plan is to be starting at exactly 7:30. So we've got 2 minutes to go. And as I mentioned to you, very much excited for you folks to be here today. And we're going to split this webinar into 2 parts. I intend to do the first part of the webinar where we're going to be talking a bit of theory so we can apply that knowledge. Then we'll have a slide that says end of part 1, and then we can divide the video. And then after that, we're going to be going into part 2 of the video itself. So with the will of God, we have 1 minute to go, and we've got individuals joining. We've got some of my colleagues, friends, family, patients are on Zoom as well. So we've got quite a lot of them on Zoom at the moment, and we've got them live on Facebook as well. So welcome everyone this evening for being here. We have literally 1 minute to go. We're going to be starting. This webinar is going to be on the urinary tract infection, and we are just going to get ready to go. I hope you can see everything, which is very important that you can see my slides, and which is great that I've just had someone let me know that we can. And that's my wife, who sat right next to me. She's always here when I'm doing these webinars, so she gets to listen to them a lot. And we have, if I look at the time now, 1 minute to go. Really, really looking forward to this because I just think it's going to be great. It's going to be a really great evening today, inshallah, with the will of God. So we're going to be starting that today. And according to my watch, it is just about to hit 7:30. It has now. And let's start. Bismillah ar-Rahman ar-Rahim. I'd like to start with the name of God. Thank you very much for everyone who's here today. My name is Fahim Ahmed. I'm your instructor today, and we are looking at urinary tract infections. So just a bit of a disclaimer that everything that we're discussing today is for teaching purposes. We are giving general advice on urinary tract infections. And again, they're written and reviewed by experts in this field. If you do need any medical advice, please get in touch with your pharmacist, your nurse, or your doctor for personalized medical advice. This is not to replace any medical advice that you would receive from a healthcare professional. This is in a teaching capacity. So I hope you find that useful. Today's plan is straightforward. I want to ensure that you have a better understanding of urinary tract infections because it's something so common and we see it so commonly in all our settings. So essentially what I want to make sure is you know how to spot a urinary tract infection. You know when to seek a clinician, when to go to a pharmacist, and when it warrants further treatment to go be seen by a doctor itself. So initially, I'll be doing a very brief introduction, and then we're moving on to UTIs, the cause, the management, the treatment, a summary, and any questions you may have, I intend to answer. So I qualified as a pharmacist in 2010. This particular webinar is being done on behalf of Amy's Pharmacy. So I'm very much grateful for Amy's Pharmacy, very much grateful for all the support that we received in Bicester and Oxford, so thank you. And there's a bit of a timeline that we've been through a lot of time. We set up our second pharmacy. We've now set up our clinic in Oxford as well. So, do get in touch, folks. I had then gone on to win the Pharmacist of the Year last year, finalist this time. Again, alhamdulillah, with the will of God. So the aim of this webinar is to explain what is a urinary tract infection, what do we mean by the term urinary tract infection, how do you diagnose it, what are the signs and symptoms, what do we do as clinicians, how do we treat it, and what you need to be thinking about if you do encounter this particular condition itself. So something that I do want to go through that I want to highlight from the outset, and that is that it's going to be important for you to have a very clear understanding of what is the urinary tract. Now, we talk about this term all the time. We mention these terms, urinary tract infection, but what does it essentially mean? Well, the urinary tract comprises of the kidneys, the ureters, the bladder, and I think it's a bit naughty here that we mentioned bladder. Essentially is the urinary bladder. Okay, I'm going to put urinary there. And the reason I like to be a bit more specific is because we've got two bladders, as you might be aware of. You have the gallbladder and you have the urinary bladder. So it's very important for you to be clear to know what bladder we're talking about. But I'm talking about the urinary bladder here. And then we have the urethra. So whenever clinicians talk about a urinary tract infection, it is an infection that can involve any of these structures. So a urinary tract infection could involve the kidneys. It could involve the ureters, which are these tubes that connect the kidneys to the bladder. Okay, so this is basically the tube where urine can pass and all sorts of the substances can pass through. Essentially, the kidneys play a major role in this. So I'll highlight this. What's going to essentially happen is you're going to have various waste products and so on make their way through this tube. Okay, so you've got the kidneys and you've got this tube with the ureters. Okay, there's two of them. There's normally two of them anyway. And this is then, all these substances, liquid substances and so on are then stored in the bladder. And what bladder are we talking about? The urinary bladder, which is here. Okay, so we have the urinary bladder here. And then everything, once we're ready to get rid of it, is expelled through the urethra. So this is expelled through the urethra here. And then we have various different organs that will help removal of this. And for those of you who don't know what anatomy means, essentially anatomy is the study of the human body. So here we're talking about the various different parts of the human body. So this is very important for you to be able to for clinicians, for doctors, pharmacists, nurses, for us to be able to essentially help your patients, we need to know what the human body is. You have to know what the parts of the human body are, what their function is, and what happens when things go wrong. Okay, if you don't know that this is the nose, then how can you really have an understanding what happens when things go wrong? So that's what anatomy means, okay? So briefly, the urinary tract includes the kidneys. That's this bean-shaped organ, and I've highlighted that there. Okay, we have that there. It includes the ureter, and the ureters are these tubes that connect the kidneys to the bladder. And the bladder is essentially where we store urine and so on. And then the urethra is where we expel our contents from there, okay? So when we talk about a urinary tract infection, you now have an understanding that it could affect any of these organs, okay? And we can divide the urinary tract into upper and lower. And this is very important because you could have an infection. So you could have an infection that just involves the lower urinary tract, okay? And that could involve the bladder, that can involve the urethra, okay? Or you could have an infection that starts to involve the upper urinary tract. So that's where you have involvement of the kidneys or you have involvements of the ureters. And what I've done is I've mentioned some common infections that you may have come across. And one of these infections is cystitis. Cystitis literally refers to inflammation, and let's ignore the term inflammation for now, but that essentially means swelling. In simple terms, it's where your body is literally not functioning properly. It's becoming it's not functioning properly. Let's just leave it at that without going too much depth, but it means it's not functioning properly. But cystitis essentially means infection of the bladder or inflammation of the bladder. So the bladder has now become, it's not functioning the way it should. It's become affected. Maybe it's an infection or it's been torn or anything of that sort, but it's not functioning at its full capacity. Or you could have urethritis, which means inflammation or infection of the urethra. Okay, now these two are something that can be very easily treated in a, can be very easily treated in a pharmacy setting if your pharmacist is a prescriber, okay? Or essentially what they can do, they can refer you to your GP, but we're going to be focusing essentially on cystitis. That's what our focus is. So we're not going to be focusing on urethritis. We're going to be focusing on cystitis, which is here. That's our major focus. If you start to have involvement of the upper urinary tract, so this could be the ureters, this could be the kidneys, that is important for us to manage slightly differently, okay? So whether it's a pharmacist, whether it's a doctor, whether it's a nurse, we do get very much concerned when the infection starts to make its way upwards, okay? So we are comfortable with an infection that's around here, okay? So anything below here, it's okay. We can nicely manage that. There's less risk of complications. So if it stays around this region where it's affecting possibly the bladder, possibly the urethra, we are not overly concerned, if that makes sense. We're concerned, but it's not as serious as if the infection starts to make its way upwards, okay? Obviously, as a patient, it's very, very important to you to seek medical advice. Very much important for you to seek medical advice, whether it's affecting the lower kidney, the lower urinary tract, or the upper urinary tract. But what is important for you to remember as clinicians, that this is something that we can quite easily deal with within a community setting, for example, a doctor, a pharmacist, or a nurse. Again, with a pharmacist, those pharmacists that can prescribe, certainly they can help you within a pharmacy setting like within our clinic. But if you have a pharmacist who can't prescribe, they can certainly refer you to a clinician who can help you, can prescribe. Okay, so to summarize this slide, the urinary tract consists of the kidneys, the ureters, the urinary bladder, and the urethra. We can divide the urinary tract into two. Okay, we have the, oh, let's straighten that. Here we go, let's straighten this. We can divide the urinary tract into two, where we have a lower urinary tract and an upper urinary tract. Upper urinary tract, more complications, more things can go wrong. Lower urinary tract, the treatment, it's fairly straightforward, and we can nicely manage that. Now, I just want to highlight as a patient, that does not mean that you take any of these conditions lightly. Please don't think what I'm saying is, oh, it's just a lower urinary tract infection. No, no, no. If it stays at a lower urinary tract infection and isn't managed, then it will travel up to an upper urinary tract infection, and that is not a good idea. So you do need to be seen properly. But if you have a lower urinary tract infection and we don't control it and manage it, it's going to make its way upwards, because bacteria are not just going to sit here. Imagine this is bacteria. They want to move around. Okay, they're going to get bored just sat here. They're going to think, okay, Fahim, we're bored of this. Let's make our way up, and they are going to make their way up. So we do need to treat this. We do need to treat this properly, and we do need to treat it promptly. But if we catch this problem while it's affecting the lower urinary tract, we can nicely manage that quite straightforwardly. Okay, unless you have complications and so on. So that's a bit about there. The functions of the kidneys are very diverse. Okay, the kidneys are these bean-shaped organs, and I'll tell you exactly where they're located in a moment. They're these bean-shaped organs, and they have many functions. Some of the functions include excreting waste like urine and so on. So you know about this. Okay, and again, this is I'm keeping it very, very straightforward and simple. They also play a role in regulating various ions or various salts like sodium, potassium. And you know, sodium, we have that in salt. Potassium, we find that in bananas. You have that in the human body as well. You don't have bananas in the human body. So don't tell anybody that Fahim said we've got bananas. That's not what I meant, but you have various salts in the human body. So essentially the kidneys ensure that the human body is able to maintain its internal environment. So what do I mean? When we want, for example, a car, when we run a car, the car has to run at a certain temperature. If it goes too hot, it's a problem. If it goes too cold, it's a problem. Same thing with the human body. Your human body has to maintain a certain temperature, has to maintain a certain level of confidence within itself at certain limits. So your salts can't go too high, your blood pressure can't go too high, your sugar levels can't go too high, they can't fall too low. Let's think about something like your calcium levels can't go too high, they can't. So everything has to be maintained, okay? And the medical term for this is homeostasis. Homeostasis. So if you ever come across this term, essentially homeostasis literally means that the body is functioning within an optimal range. Okay, so the blood pressure has a certain range. Your sugar levels have a certain range. You going, for example, you producing enough urine, there's a certain range. Too much urine is not good, too little urine is not good. Everything has to be balanced in life. Same thing with this. So again, the kidneys play a big role in that. Removal of waste, making sure that your salts are at the right level, has a role in vitamin D as well. So it's a very diverse organ, and we're very blessed to have this organ in terms of what it does as well. Okay, that's just a bit of information there. I want to highlight this point and make it very clear where the kidneys are located. Okay, this is something I see all the time, especially whether you're a clinician, pharmacist, nurse, and so on. It's very important for you to know where the kidneys are located. The kidneys are not located in the lower back. Please, 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 please remember, the kidneys are not located in the lower back. The kidneys are not located here. Okay, the kidney is located, and how you can spot it, you can all do this at home. Here is where my rib cage ends, right here. So if you were to literally feel for your rib cage and work your way backwards, where the rib cage goes across backwards, you will come across essentially the rounded part of the rib cage. So literally all you have to do is do this. It's easier on a child, but if you were to grab your hands and go all the way back, so if I go all the way back here, I can feel that my rib cage is ending at the back about here. This is where my rib ends. Where my rib cage is, behind my rib cage is ending. That's where the kidneys sit. So actually, if I stand up, let me show you. My kidneys are sitting at about here. Okay, I hope you can see that and it's clear. But my kidneys are sitting at about here. This is where they are. They are not here. This is lower back. They are upper back. How you can do that? Very straightforward, okay? If I have a look at my rib cage, it's here. So I can literally put my hands and go across here, here. I can feel it going across here. I can feel it going across here. And my rib cage is ending around here. This is where it's ending. So the kidneys will sit around there. Below this, I don't have any rib cage. This is muscle, this is different tissue. My rib cage is not here. The kidneys sit here. Why that's important is when we mention patients who present with back pain, it's very important as a clinician or even patients to be aware of the kind of back pain that you're having. Is it because my kidneys are affected, or is it because it could be muscular related? Now, as a patient, I don't expect you to start to identify this yourself. That's my kidneys. You will always go to your clinician, whether it's a pharmacist, whether it's a doctor, whenever you're having back pain. I don't want you to sit there saying, oh, okay, that's where my kidneys are. Fahim told me that's where my kidneys are. So this is lower than my kidneys, because the human body, remember, is very complex. It does not listen to my lectures. It does not read my lectures. It does not go by what I'm explaining to you. Some people may have pain that's slightly lower, or they may perceive it to be slightly lower, but it's affecting the kidneys. But I just wanted to point out where the kidneys sit in terms of structure. So this is where the kidneys sit. The kidneys do not sit lower down, okay? And what we do as clinicians, very straightforward, is we look for this angle that is formed. We call this the costrovertebral angle. And you can see it here. It's this angle right here, okay? This angle right there, what we can do, if we feel that somebody's got an infection of the kidneys, we can actually literally, what we do is we find this angle. This is known as the costrovertebral angle. So I'll draw it here. We find this angle, and literally what we're going to do, we're going to have a feel of this angle. And if it's painful here and it hurts here, then we can say, aha, this person may be having involvement of the kidneys itself. That's what we do. That's literally when we have a patient and we think that actually that this patient may have involvement of the kidneys, literally what we will do, and I can demonstrate this to you, we will look for the angle. So here's the angle, and we can literally tap across like this. And if you were to say, ouch, for him that hurts, we can say, there's involvement of the kidneys. Just, I thought that'd be quite interesting for you to know. So that's essentially where the kidneys sit. So I hope that's clear about where the kidneys sit. Again, there's a picture here highlighting that same point, and you can have a look. There's the lower back. You can call that the lower back right there, okay? If we make our way upwards, and I will draw this here, and let's draw this. Let me change this for you. here is what you're talking about, the upper back. There you go. And that's where the kidney sits. So you can look that this region here is all, let's change this color actually. This region here is all lower back, okay? And if you're unsure why that's important, it's important for clinicians to know exactly where the kidneys sit, because if we have a patient who's got a lower urinary tract infection and the infection is spreading, then patients will come say, I've got back pain. And we need to make sure that is that back pain because of the kidneys, or is that lower back pain that you may have had for a very long time, okay? Right, so brief recap, we've divided the kidneys, not the kidneys, so we've divided the urinary tract into lower and upper. What is the urinary tract? The urinary tract essentially is literally this collection of organs that involves the kidneys, ureters, bladder, urinary bladder, and urethra. The lower urinary tract is your bladder and urethra. Upper urinary tract is your kidneys and your ureters. Remember, this is ureter, not urethra. Ureter, okay? This is urethra. Okay, very similar terms, but they're different, okay? Now, as I mentioned to you, we do start to get worried about this. If the infection starts to spread up, we do start to get worried about this, because if it's spreading up, it can make its way further inside, and that is a problem. So we do get worried about this. But lower urinary tract, as I mentioned, we can manage it quite easily. Less risk of complications can be done. Okay, and there's, as you can see, the human body is, we're absolutely gifted to have this wonderful, this piece of kit, as I like to say. Just have a look how delicate it is. That's just the urinary bladder, and it plays such a huge role. Let me give you an example. If your bladder wasn't functioning properly and you would be finding it very difficult to sleep at night, because your bladder would be filled up, it would be stretched so much, it would tell the brain, I need to go to the toilet, I need to go to the toilet. At night, you couldn't sleep. What a blessing that we have, that this bladder, when it's functioning properly, how lucky we are. It's such a tiny organ, we don't think about it. But just imagine that if your bladder wasn't functioning properly, it gets filled too fast or can't hold the contents. Either you're going to have where you can't hold your contents and unfortunately you wet yourself, or your bladder literally, it holds too much. And if it holds too much and it doesn't let you expel the contents, it's going to work its way upwards. So even something like the bladder, it's just mind-blowing how we're so gifted to have these organs. It's very important to look after them. Just a quick point, if you have an infection of the kidneys, we call that pyelonephritis, okay? Pyelonephritis, the word nephron or nephritis is actually, it comes from parts of the kidney that play a very important role in their function. Nephron, okay, pyelonephritis. Ureteritis, you should know now, affects the ureters, ureteritis. And actually, let me tell you something, whenever you hear the term itis, it means problem. In actual fact, it means inflammation, but essentially it means it's a problem, that something's not right. If you ever hear the term urethritis, or you hear conjunctivitis, but essentially it literally means that there's a problem happening, okay? And remember that inflammation is just your body's response. When things are not right, your body will release all these different chemicals, all these different substances to help you repair itself, and we call that inflammation. Inflammation is not a bad thing, but your body will cause pain in various things. So essentially itis means, for you to make it remember easily, problem, but the real term, it means inflammation, okay? What is inflammation? Just think of inflammation when you're not well and your body has to repair itself. It goes through this chemical process, a range of events to fix itself, and we call that, and that's what we call inflammation. But anytime you see itis, and you're going to see this all the time, right? Have a look here. Itis, cystitis, urethritis. And we as clinicians see this all the time. So I thought that'd be interesting for you to be aware of. Right. This part is very, very important for you to know, because this will tell you why women, unfortunately, ladies, are more at risk of developing urinary tract infection. And there's a very simple reason for this, and that is because of the close relationship between the anus, which is here, and the opening to the urinary tract, which is the urethral opening there. Okay, So you might be wondering, Fahim, what are you on about? Why is that a problem? Why that's a problem is because if you have, for example, remember that when you have feces, and this, I don't intend this lecture to be graphical, but let's just imagine that's some feces right there, right? Again, I don't intend this to be graphical, but let's imagine there's feces. Okay, remember, feces essentially are all the various substances that we couldn't dissolve, that we couldn't break down, that we couldn't make use of inside there. Also, what we find inside them is bacteria. What do we find inside them? We find bacteria inside them. So that's what I want you to focus on. We've got bacteria, right? Okay, so Fahim, I get that. There's bacteria inside these feces. So what's the point? Well, if there's bacteria here, and somehow the bacteria can make their way from the anus all the way to the urethral opening, where do you feel they're going to go next? They're going to have a party. They're going to go inside the urethral opening. Okay, so let me bring your attention here to this diagram. What is going to happen is they're going to think, great. So they've made their way from here, and they've made their way here. And where they're going to go? They're going to go inside. They're going to go to the bladder. Okay, that is where you're now going to have a problem in the bladder. So we can draw these bacteria, these bad guys who are like, great, we're having fun in here. And if they're not happy with that there, and they think, okay, you're not doing anything about it, let me tell you I'm here, we're going to make our way upwards. And we're going to go into ureters. And then we're going to go make our way into kidneys. And that always means it's a problem. That is the problem with, unfortunately, the way that the human body's been designed with women, there's a very close relationship between the anus. Although here, it makes it look like there's a huge gap, but there's not a huge gap. It really makes it look like it's very close. So the close approximation between the anus and the opening of the urethra mean that bacteria can easily basically cross-contaminate or basically start to make their way here and start to take residence here and then make their way inside. That's why we always say with women to wipe, we ask you to wipe from the urethra to the anus, not from the anus to the front. So we always say wipe from front to back. The reason we say wipe from front to back, so you're wiping from the urethra where you were to expel the urine and so on, you wipe from there all the way behind to the anus, because that way what you're doing is there's no chance of any sort of bacteria making its way this way. This way. If you wipe the opposite way, where you wipe from your bottom to the front, okay, so you're wiping from the bottom to the front like this, you're going to have a problem. Okay, so I hope that makes sense. I hope you found that useful, but that is why women are unfortunately more at risk. Men, on the other hand, are at less of risk, and there's another reason why, because I want you to have a look at the urethra. Compare the two urethras, right? So here's a female urethra and here's a male urethra. Now, if bacteria are lucky enough to somehow make their way from the rectum or the anus all the way to the penis, they still have to make their way quite up all the way here. They have to travel, and then they have to get into the bladder. So it's quite a long journey for them. Okay. Whereas here, as you can see, they just have to cross. Literally, they just have to get around here. Okay. Remember, everything is quite close. They literally have to travel this distance right there. Okay. But they have to travel to get into the bladder of a male. Look at that distance they have to travel. Huge. It's a big difference. Okay, so that's partly the reason why men are less at risk. It's also why if we have a male patient, whenever we have a male patient with a potential urinary tract infection, we tend to be a bit more, I won't say worried, but we tend to be making sure that our thinking caps are on. Our thinking caps are on all the time. But we do really tend to think, okay, if a male has it, we need to be very careful. Why? Because the way the human body in a man has been built, you're less risk of getting this. So what's going on? What is going on? Okay, so that's essentially important there. Right, let's move on now. And this is the end of part one. As I mentioned to you, this is the end of the part one. Okay, because I'm going to be dividing these videos into half. So I'll now continue the next session. I'll have literally just a two second break, because I want to, for my patients, to make it easier for you to watch. I want to divide the videos into two parts so you can watch it again rather than one whole lecture of 1 hour. We can divide. So we'll just have a pause here for 2 minutes. Well, not 2 minutes, less than 5 seconds. And now we can continue to part two, because I'll half the video. So welcome to part two. This is part 2, urinary tract infection. So what is a urinary tract infection? Well, a urinary tract infection is an infection of the urinary system. What is the urinary system? We've already discussed that in our previous slides. This is the urinary system. It is any one of these organs. What is an infection? Literally, an infection is where your body is now having to deal with the bad guys. So an infection is literally your body having to deal with bad guys. Those bad guys could be bacteria. Those bad guys could be viruses. Those bad guys could be fungus. But essentially what it is your body has now been invaded by folks that we did not want to be there. We don't want bacteria to be there in our space. Okay, so they've invaded your castle. That's an infection, and it can affect the urinary system. Again, what is the urinary system? The urinary system essentially could involve the kidneys, could involve the ureter, okay, and we call that upper UPPR. I'm going to call it upper urinary tract, UT, okay, and it also could be the bladder, urinary bladder, and the urethra, THRA, urethra. Okay, that's the urinary system, and I've drawn that picture there as well. That's the urinary system. It's an infection of any one of this. So when we say you have a urinary tract infection, if you say to me you have a urinary tract infection, I need to make sure, where is it? Is it your lower urinary tract or upper urinary tract? And up to 60% of women will have an episode once in their lifetime. That's huge. So again, as I mentioned to you, it's very common with women to have this, and up to 60% of women will actually have this once in their lifetime. So it's quite huge. Sexually active women, young women, tend to be more at risk of developing urinary tract infections, and there are various reasons for that, but I won't get into that, but we can leave it at that women are more at risk. And we can divide urinary tract infection to upper and lower. So upper would mean that it's affecting, essentially upper means that it's affecting any one of these organs here, okay? That is the kidneys or your ureters, okay? If it's a lower urinary tract infection, so it's a lower urinary tract infection, essentially it is now affecting the bladder or it is affecting the urethra, okay? We can, as clinicians, also divide this into complicated and uncomplicated. And I'll give you a brief definition of complicated. So when we think of a complicated urinary tract infection, we are thinking of those individuals who are more risk of this infection causing bigger problems to the human body. Okay, men, for example, we said would be complicated. Women who get recurrent infections. So if you've had twice in 3 months or 3 in 12 months. So if you've had it 2 times in 6 months, we call that, 2 times in 6 months. So I don't mean 3 months. If you get it 2 times in 6 months, we would say that is a recurrent urinary tract infection. If you get this 3 times in 12 months, that is again, as I mentioned, that's a recurrent urinary tract infection, okay? So that is important for you to remember in terms of how we define it, how we actually define it. So essentially how we actually define it would be if you have a patient who has it twice if you were to have it twice in 6 months, we would class that as a recurrent infection, or 3 times in 12 months. So just keep that in mind. That's important for you to remember. So it can be complicated. So complicated are those individuals who we worry about complications. Okay, so this could be men, this could be women who get it recurrent. So if you've come into my clinic and you've had it twice in 6 months, okay, or you've had it 3 times in 12 months, that's quite regular. If you're somebody who has a catheter fitted, or you have an anatomical problem, or you have a low immune system, we classify this as complicated. Uncomplicated cases would be a woman who's not pregnant, fit and healthy, does not have it regular, and is generally keeping well. Again, pregnancy is something that we would also classify as complicated. So I guess essentially you've learned something today, that you can divide lower urinary tract infections into upper, lower, and the upper ones are at more risk of complications. So be careful with that. The lower urinary tract, bladder, urethra. Complicated are those who are increased risk of developing problems, okay? And then we also have uncomplicated, which is essentially women who are not pregnant, fit and healthy. They are classified as uncomplicated. Again, what is the cause? As I've mentioned to you, and it's very important for you to remember that essentially those bacteria that exist in the feces are going to make their way to the urethra, okay, and they make their way through there. And then if you imagine here, there's the urethra, they're going to make their way up, and they're going to either enjoy themselves here for a bit, or unfortunately, they make their way further upwards to the kidneys, and then we have upper urinary tract infection. And from there, it can spread further. So how do patients present? So commonly, patients will present to us with, I'm having to go to the toilet more. One, it hurts when I go to the toilet. Another one, sometimes we see blood in the urine, where women will come or will present. I'm going to stick to women who say, I've seen blood. Smell, sometimes they say it's very off-putting smell. Occasionally they have abdominal pain, and the abdominal pain tends to be below the belly button, around that region, okay? We tend to have that. So these are common features of a lower urinary tract infection. Now remember, I have not mentioned anywhere here of a patient complaining of back pain, because that would mean that this infection is making its way upward. I've also not mentioned a patient presenting to us saying, I've got a fever, or I'm having periods, or I'm forgetting things, or I feel unwell. Most women with a lower urinary tract infection will simply say, I'm having to go to the toilet more, it's stinging, it's burning, or it's painful, or I have blood in the urine, it smells, or they'll say, look, Fahim, I've had this before. And to be honest, I've read various studies, and what they show is that women, majority of the times, get it spot on. So women, majority of the times, absolutely get it spot on. When they're having a lower urinary tract infection, they know they're having a urinary tract infection. So hats off to you women. You know exactly, you know the body, you know the human body, you know yourself. So it's important for us to remember that no one knows the human body better than the patient itself. And women are very good at knowing that something's not right, okay? Upper urinary tract. So when is the infection now making its way upwards? So fever. So some women, again, with sticking to female, some females will say that they've got a fever, and it could be a mild fever. It could be just, where we have various grades of fevers. It could be a mild fever, okay? Some women will say, actually, I feel cold. I feel like I just, I feel shivery. I don't feel well. Some women will say, look, I feel generally tired, and malaise. Malaise actually means when you are essentially, you're tired, but you're not tired like when you go to exercise. Now, when we go to exercise, we get tired, but we feel good. Malaise is where you're like, I've not done anything. I just feel tired. I don't feel well. And that's your brain telling you that something's not right. That's why it makes you feel like this, because essentially, if you're not well, the human body has been designed for you to take a break. That's why you're going to feel like I'm not well. It's your body's way of saying rest, okay? And I mentioned it beyond what's normal for you. Other features that which suggest that things are getting worse, when we say this term systemic illness, okay, you may have come across this or you may not have come across this. Systemic illness essentially means where the infection has now spread, is starting to spread more in the human body. It's starting to go towards the blood. It's starting to spread in the blood. It's starting to spread everywhere. And women or anybody will present with changes in their blood pressure, changes in their pulse, their breathing rate might go up. They may look unwell to you when you walk in, you think, wow, you're looking well. That's that infection spreading, okay? Also, what we look for is people will complain of back pain, okay? And we can ignore this for now about men complaining of pelvic pain, because we're not intending to discuss a lecture on men. This is more focused on women. So as I mentioned to you, lower urinary tract, women will present to you, pain, I'm having to go to the toilet more, okay? It hurts, it stings, there may be presence of blood. And even some women will say to you that actually I feel it's coming on. That's that I've had, and they're right. They will present to you saying, look, Fahim, I'm telling you, I think it's coming on. So again, women, we know, you very much know the human body very well in terms of, so you're aware, but these are the common scientific features that we look at. But remember, the human body has not read this lecture, has not read textbooks, so you can present with many of the symptoms, okay? But these are the classical symptoms. And upper urinary tract infection, as I mentioned to you, fever. So some women some women will present with fever. So that's quite important. They present with, they'll be feverish. Okay. So that is quite important that some women will present with fever. We also find they might have chills, generally tired, unwell. They may have back pain as well. So again, these are important for us as clinicians to keep an eye on. And it's important for as patients as well, because if you're having any of these features, it's very important that you seek medical advice very soon, because that infection could spread and get worse. Okay, I hope that's clear. If you do have any questions, please leave it on the chat. I'm more than happy to answer it for you. But I just wanted you to go through what we do. You might have seen that a lot of doctors, pharmacists, clinicians will dip the urine. So we dip the urine and we look for various things. We look for presence of essentially any sort of indications of white, any sort of indication of infection in there. We look for any sort of blood that might be present in there. We look for possibly this something known as nitrites. Okay, this gives us an indication that there is bacteria present, but we can not easily dip the urine. Once we've dipped the urine, we can, coupled with your symptoms and signs, we can easily fit a picture. Now remember, there are many diseases that can present very similar to a lower urinary tract or an upper urinary tract infection. That's why it's going to be a trained professional, a pharmacist, a nurse, a doctor, who will be diagnosing this for you and treating this. So please don't diagnose it yourself. Get medical advice, always get medical advice to ensure that you're doing the right thing. Okay. In terms of treatment, we will very much go by our local guidelines. Okay. Again, just something to point out, folks, that we don't always have to treat things with antibiotics. You might have heard this a lot in the press, that we are trying to protect our antibiotics. You don't always need an antibiotic for various infections such as colds, coughs. You know, it's important for us to look after antibiotics, because if we don't look after antibiotics, then in the future, when you do need antibiotics, they're simply not going to work. But for lower urinary tract infections, we normally treat with antibiotics. Again, that's a discussion that we have with the patient and the clinician. And we like to go with nitrofurantoin. If you've used it before and it's working well for you, you don't have side effects and you don't have any sort of resistance in the local area, we can also go with trimethoprim as well. And what we find is 3 days seems to be quite good enough. What we're finding now is a 3-day course is enough to treat. And then there's various other antibiotics as well that we do have available that can help, essentially. So nothing to panic there. And patients will normally respond within 48 hours. I've very, very rarely in my practice of seeing over hundreds of patients with lower urinary tract infections have I come across a patient who hasn't basically had an improvement in their symptoms within 48 hours. Essentially, patients will say that, yes, the stinging has become less. I'm not having to go to the toilet more, maybe they might say, or they simply say that we're feeling better. We're feeling a lot better. So again, any one of these features mean that we're going on the right tracks. If we don't see an improvement, well, let's say 3 days have gone, but your symptoms are getting worse, or you're getting more back pain, or your blood pressure starts to fall, or you start to get a temperature, then we have to reevaluate, okay? So that's some information there. Please make sure that you drink plenty of water. And now what we mean by plenty of water is not more than 2 liters, because if you drink too much water, it can wash out the antibiotics as well. So 2 liters of water is more than enough to drink. Okay, drink plenty of water, stay hydrated, eat well, give yourself proper nutrition, rest, and things should start moving in the right direction once you've had treatment. So summary, urinary tract infections are very common in women. What is a urinary tract infection? It's an infection of either the kidneys, could be the ureters, which has the tubes, could be the urinary bladder or the urethra. We can divide it into upper and lower. Upper, more risk of complications. Lower can be very easily treated and managed. More common in women because of the way in which women have been designed. And remember to always wipe properly from front to back. Okay, so where you urinate, where you're urinating from, we want to wipe from there to the anus, not from the anus to where you urinate from. Otherwise, you're spreading bacteria there. Drink plenty of water, wipe correctly. If you're having these regular, get in touch, pop into our clinic, get in touch with your doctor, get in touch with one of the clinicians, very important. If you're having these symptoms, make sure that you do get this seen with. If you have any questions, I am happy to take them on YouTube now. Please leave them there. Please remember to like, share, and subscribe to this YouTube channel. We will be doing these webinars every single week. That's the plan. We're doing these webinars every single week. And from my side, we have wrapped this up in 40 minutes. So I'm happy with that. Again, I very much thank you for being here today. I will hang around for a couple of minutes if you've got any questions. Otherwise, have a wonderful evening, stay safe, and look after yourself.